Hi, my name's Rob Rogers. I am the Assistant Director of Substance Use Prevention and Grant Services at Kennebec Behavioral Health. And I currently hold a LADC, which is a licensed alcohol drug counselor. I am also a licensed social worker, and I am a certified prevention specialist for the state of Maine. Currently, in my role as the Assistant Director of Substance Use Prevention and Grant Services, I am doing a lot of work contracted from the University of New England, specifically addressing prevention efforts for adolescents and young adults in central Maine in tackling issues related to the use of marijuana, alcohol, and prescription drugs. I also am the director of a certified batterers intervention program for female offenders called the Respect Me program. So by doing that, I'm able to have some diversity in my job as it relates to behavioral health. I certainly never get bored. There's always something new going on. I'm on the road a lot, working with various school districts, healthcare providers, and other social service agencies throughout Kennebec and Somerset counties. As far as why I chose this field, it really does go back to high school, and sort of the field chose me. I was fortunate enough to have a teacher in my school that asked me to get involved as a teenager in substance use prevention. That really stuck with me. And then I ended up going to school at the University of Maine at Farmington in their rehabilitation program. And from there, graduated with my bachelor's degree. Went on to work in the crisis field for a couple of years. And from there, I went on to work at a social service agency overseeing programs related to child welfare and family reunification services. I always had an interest in substance use and the prevention of the use of substances, and got my license that allowed me to do treatment services, and really continued my education throughout my employment. I did not go on and get a master's degree, but I was able to advance in my career by obtaining special certifications and receiving education that way. Working for an agency that provides good supervision is very beneficial and has really allowed me to progress in my current positions. As far as what I enjoy most and what is gratifying is really those aha moments when you're working with somebody and you see that they just sort of get it. In looking or talking about substance use, that moment where I'm able to provide some education to somebody, and somebody who may not have ever thought that they had a problem with substances all of a sudden has that moment where maybe I really do, and they decide to reach out and start working on their path to recovery. An example that I can share about that, I teach a program called SIRP. It's the Student Intervention Reintegration Program, specifically working with high school aged youth that have had the use of substances, likely been caught on campus using, and they get 12 hours of education. And the idea is that they can recognize the impact that their current use is having on what they want to accomplish in life. And I had this one individual several years ago that had always reported that he had always driven after he had been drinking. And he came to one of our classes, the weekend had taken place, and he came to me and was like, oh, I drank this weekend. And there's this part of you as the person providing the education that gets really disappointed. It's like, they're not getting it. And what he said next is what impacted me. Is he looked at me and he said, but after I'd been drinking, I remembered what you've already shared with us. And it was the first time in my life I didn't get behind the wheel of the car. And I stayed put. So for me, that is one of those moments where he was hearing what I was saying. The world can be quite small at times. This same gentleman, 3 to 4 years later, his aunt approached me I didn't know they were related. I couldn't confirm that I knew the individual, and his aunt knew that. But she said, I just need to tell you that the education you provided to my nephew 3 to 4 years ago stuck with him, and he's now sober. So when you think about why do you do the work, that's why I do the work. I want people to be able to live healthy, productive lives. Challenges, challenges are going to take place in any profession. We certainly don't have our shortage of challenges in the substance use prevention field. Certainly some of that relates to, do I have the funding that's going to allow me to continue to do my work? The stigma attached to people that use substances, and getting people within the community to see them as people and that they're not evil and that they need help and that substance use is a disease. Those are really challenging. Advice for people thinking about going into the behavioral health field, I would really encourage you to think about what your passion is. Do you enjoy helping people? And then I would also encourage you to reach out to some people that are in the field, talk to them, find out why they're interested. What are the different types of jobs? Talk to some of the colleges, ask them, what would my career path be if I chose this? What are the different types of jobs I could have? I was able to share with you what I do in my work. Hopefully that was helpful.